Where's Mike? Mike, Diane and Dementia number 50. Pneumonia. Before we left for Hilton Head, I attended one last support session. In our dementia support group, those gathered around the table looked tired, worn down. It's important for caregivers to get some respite time because dealing with a loved one so afflicted drains the hell out of you. You have less and less energy to look after yourself. Karen has helped me immensely by taking Diane for sleepovers once a week, allowing me to either rest or attend meetings. We talked about vaccinations today, and how hard it was for some to get their loved one vaccinated. We discussed therapeutic fibbing, the sort of thing I do when I tell Diane that Mike number 2 was at the house or that he said how much he loves her. Therapeutic fibbing and changing the subject are two techniques often employed when dealing with dementia patients. One lady whose husband is in late stages of dementia remarked that she would not get him vaccinated for pneumonia. That was her strategy for his demise. Pneumonia is an infection that inflames the air sacs in one or both lungs. They fill with fluid or pus, causing coughing with phlegm or pus, fever, chills, and difficulty breathing. Bacteria, viruses, and fungi cause pneumonia. It ranges in seriousness from mild to life-threatening, most serious for infants and young children. People older than age 65, and people with health problems or weakened immune systems. Signs and symptoms of pneumonia include chest pain when you breathe or cough, fatigue, fever, sweating and shaking chills, as well as nausea, vomiting or diarrhea and shortness of breath. Pneumonia was how my father exited, after being in a coma in a hospital for a few days. It didn't help that he smoked his entire life. I think pneumonia is the way a lot of older patients go. Some people catch pneumonia during a hospital stay for another illness. Hospital-acquired pneumonia is serious because the bacteria causing it may be more resistant to antibiotics and because the people who get it are already sick. Her strategy amazed me in that there is nothing to assist us when a person cannot provide consent for something drastic to solve an intolerable situation. I discussed this in another video regarding medical assistance in dying or MAID. As I predicted, elected officials in Ottawa are stalling on MAID applied to mental health issues, such as dementia. There are lobby groups such as churches and psychiatrists that are obstructing the process. These groups prefer to allow people to suffer horrible deaths. These people are content to watch the afflicted lead meaningless, painful lives. These people are self-serving and cruel. After a while, it's the caregiver who might relish dying. I am most often exhausted. My daily life has been dramatically changed. My sleep pattern has been forever altered. I spend inordinate amounts of time pretending that I am somebody else who does not really exist. I have little hope. All I can do is be patient and watch Diane's steady decline. I can't even tell her that I love her anymore, because she thinks I'm Mike number 2, and that would not be proper. Once, she warned me after I kissed her, "I am not marrying you." She has started referring to her husband as her dad. I want to curse and scream. Are you like me, coping with someone with dementia? Use the comment section with this video or others to describe your situation. Your sharing will help yourself and others. I welcome your thoughts and suggestions. If you are engaged in similar struggles, I also welcome your likes. If you click the logo on the bottom right-hand corner of each screen, you will subscribe to Where's Mike? New videos will automatically be sent your way. And you will not have to search for this channel. If you are looking for some humor to help deal with the weighty problem of dementia, subscribe to my other channel, https://www.youtube.com/@theretirementcoachqd8cb. Thanks for watching.